When you buy a newspaper in New York or Los Angeles or London, you think you're getting the local news. But as you know, sometimes if you go to a website or a newspaper, they just copy the same article from the Associated Press or one of these other news systems. You could be getting the same story thousands of miles away and think you're getting an independent story, but you're not. Well, the same thing is happening with doctors right now. There's 1 million doctors in the country, and you think they're all saying one thing because the AMA is not only saying that, they're making all the other organizations say that with your money. And they're the ones that are leading in keeping anybody from stepping out. When all the medical organizations are against you, you're not going to win a court case if you're on the other side.
You must be some kind of therapist.
Today, my guest is Dr. Travis Morrell, chair of Colorado Principled Physicians, a grassroots organization of doctors promoting evidence-based medicine and classical liberal values. He's also a senior fellow at Do No Harm Medicine. Today, we're going to discuss the medical association cabal, exposing the structure of the corruption we're seeing in American medicine.
Thanks, Stephanie, for having me on. And sorry, we need to workshop that name. Colorado Principled Physicians is a little bit to get out, isn't it? I'm sorry.
Yeah, no worries, Travis. It's great to have you on. It was so nice to meet you in person at the GenSpect conference.
Yeah, it was great to meet you, and I hope you know that this is a big moment for me. You encouraged me to go public before I did in some private conversations, and I've appreciated your encouragement throughout the way. So it's an honor to be on your podcast. Thank you.
Oh, thanks so much. Yeah, I think we just need to reach that critical mass of people who know what they're doing and know what they're talking about and are willing to use their professional credentials to speak out about these issues of corruption in medicine that we're seeing. And, we've been in touch for a little while now, but you wrote this Twitter, I'm still calling it Twitter after all these years, this thread on X that was really heady and honestly hard for me to follow because I don't have a good mind for like institutions and their structures and stuff like that. But I'm so glad that people like you do. And I really want to get into this for our listeners because you explained some of what's going on behind the scenes that reveals why we're seeing so much corruption in the medical industry. And a lot of it boils down to this monolith of the American Medical Association and all the little hats it wears as all these substructures underneath it. So we are going to talk today about that thread, and I'm going to try to make sure to link to that thread in the show notes so people can see what we're talking about here. But hopefully we're going to get a lot more clarity in this long form interview than you can even offer in an X thread. So I'm excited to get into it.
Yeah, thanks. I think it's important to see how the sausage is made, to see how the mafia, so to speak, is laundering the evidence, because it's people all want to know why this is going on in medicine, why the gender craze, why the diversity, equity, and inclusion craze, and there's reasons behind it. And I think I appreciate this opportunity for a longer form to dig in.
Well, so what we do know, anyone who's been following this issue knows that there is this sort of manufactured illusion of consensus. And where that's showed up in different people's lives, for my life, it's looked like activists trying to threaten my license as a psychotherapist because I had what was at the time seemed like an unpopular opinion, although it's actually not unpopular. Like most people agree with me, I've discovered at this point, especially in 2025, almost the end of 2025, maybe 2026 by the time this comes out for all I know. But the illusion of consensus has been manufactured through a variety of ways. And like I said, the one that I've been personally sort of victimized by was that they say that there's this consensus, but really how they manufacture that is that if you have the professional credentials and you say something that they don't like, no matter how much you can actually back that up with reason and theory and philosophy from your school of thought or evidence-based medicine, if you're a doctor, no matter how much you can back it up, there are people who will try to say, you're not allowed to have that opinion and hold that license. We're going to take your license away. So that's just one little way that obviously I talk about a lot on this podcast, but you're going to help us understand some of the other ways that activists are manufacturing this illusion of consensus about quack medicine.
Yes, illusion of consensus is the best phrase for it, I think, because if you ask most doctors, I'm not sure if it's true for most therapists right now, but you can tell me. But if you ask most doctors, they're not going to be for some of this non-scientific garbage that's hurting people. They're just not. But there are ways that they manufacture this. You're kind of talking about the bullying or the kind of ending the free speech or ending independent views. But some of the things that we're going to talk about today, there's actually big organizations that are lined up behind this, just right there in the open, to kind of manufacture this consent within medicine.
So should we start with the AMA then? Where should we begin?
Yeah, that's a good question. So, well, I think I'd first start and talk about how honestly doctors have made mistakes before. But what makes this different? And I would say, it's okay for doctors to make mistakes. Sometimes at the end of the day, right, if you get in a car accident or you get pneumonia, or hopefully if you get cancer, hopefully you want to go see your doctor. That being said, I hate to say it, we've been slow to move with the evidence in the past a couple times. There's the sudden infant death syndrome in the 90s that the American Academy of Pediatrics, kind of American medicine, was a couple of years behind the evidence when other organizations were recognizing that there's a safer way to put your baby to sleep, and they dragged their feet on that. American medicine was complicit in starting the opioid epidemic, unfortunately, which we're still having. I think it's 70,000 people die a year of fentanyl now. And so we've kind of made mistakes before, but we always fix it just sometimes 10 or 20 years later. And the problem is this time now it's so politicized and there's so many cooks in the kitchen, so to speak. This is a mistake that's been really hard to kill. The American Medical Association is a big player into why this is, like you have pointed out. So it's really confusing to understand if you're not in the doctor world, but basically doctors have organizations throughout their whole doctor life that represent them. So you go to medical school and there's organizations that represent medical school. Then you do postgraduate training called residency and there's organizations that represent that. And then you go out and work and then there's different boards in each state, and then you have a specialty organization, maybe a subspecialty organization, and then you have those at the nation and then the state level, and on and on and on. And I could keep going. Basically, we all have a bunch of groups that we're having to write checks to, and that are supposed to represent our opinions on things.
Can I pause you there?
Mm-hmm.
When you say that we have to write checks to, you make it sound mandatory. What structures are in place that essentially force doctors to join these groups?
Good question. So some of them are basically mandatory, some of them less so. So, for example, when you have to go through medical school, and there's really one organization that represents those, the American Association of Medical Colleges, the AAMC. That's a huge $250 million a year company, nonprofit, supposedly, and they are very active in this group. They openly wrote amicus briefs or arguments against arguing at the Supreme Court that schools such as medical schools should be racist and discriminatory when they accept students in. Okay, so there was, if you remember, in 2024, there was a case against Harvard, a case against University of North Carolina, and I believe it was a white woman and an Asian American guy, and they sued that they had been discriminated against. And the AAMC, our medical colleges, actively fought to try to get them to lose that case so that schools had the right to discriminate based on race. So that organization right there, every person who's a doctor ends up paying, their med school pays them, there's no way out of it. And then the rest of our career, that AAMC is fighting us and openly trying to bring discrimination. So that's one example. Now, later on as you go, some organizations you don't have to join and some you do. A lot of us do join our specialty organizations because, to be honest, if you're a plastic surgeon or a pediatrician or whatever, you kind of need an organization to kind of tell you what's going on in some of the news and in the politics and in the research and so forth like that. The American Medical Association, which itself is almost a $500 million a year nonprofit, every year. It's $450 million a year they're doing business. They have managed to kind of capture all these organizations down below, all of them, and kind of align them up under themselves. And why they would do this is because when there's a contentious issue like this pediatric gender affirming care, so-called, or pediatric sex trait modification, what position they take really affects politics, laws, news, court cases, and everything. I would note, though, that 85% of doctors don't belong to the AMA, so it doesn't necessarily represent us, but that's kind of how the organizations can be. Anything from we just absolutely have to pay to them at some point, or we maybe don't and choose to or choose not to. So there's a big variety there.
So 85% of doctors are not members of the AMA, and yet they have all of this political power.
Yeah, and so 85% of doctors don't agree with the AMA, but they have all this political power for two reasons. One is because out of their $450 million a year, probably 10% of it is actually from doctors, and probably 90% of it, or a big majority, is from consulting and fees that they get off of a government-mandated monopoly. So basically, they have so much money that's not from doctors. Literally, the AMA, if all the doctors died, the AMA would still be crushing it the very next day. No problems. They'd go on doing exactly what they're doing. It's not an exaggeration. In addition to just having unlimited money that they're printing themselves through a government monopoly, they also have managed to get all the organizations under them, including the ones that we have to pay to, or virtually have to pay to, the specialty societies and everything. They've lined those up under them through a web of money and consulting and stuff like that too. So they kind of have it locked down.
So you mentioned a government mandated monopoly, and I think that might actually be the exact same phrase that Dr. Eitan Heim used when I interviewed him recently. So can we, especially for listeners who didn't hear that episode, or for people who are just new to this issue, and as well because you might offer a different angle on things, how does the government mandated monopoly work?
Yeah, great question. So basically, doctors don't get paid to take care of you. I mean, definitely when I go into a room, that's what I'm thinking about, but I don't get paid. I don't write the insurance company or Medicare and say, I took good care of Stephanie today. Please send me a check. Okay. I get paid for sending them a code that says what my patient's problem is, and then another code as to what I did. And then a note that if they check shows that I did it. Well, that second code, that code of what I did, I spent 20 minutes talking to her, I did a surgery, whatever. That code is called a CPT code. And when, I believe it was in the late 90s, 96, I think, that when maybe everybody's heard of HIPAA, it's a Patient Privacy Act, went through. Basically, the American Medical Association managed to get in that says all these codes, the AMA is going to be in charge of that. Well, those codes are copyrighted. So every doctor, every hospital that you've ever seen in your whole life, unless you literally paid them cash like under the table or something, which you probably shouldn't do, every doctor that ever took insurance from you in your entire life used that code and had to pay the AMA. And physician's assistants, nurse practitioners. It doesn't have to be doctors. And that's why I say if we died, they'd still be making this money. So they're just making a little bit of money here and there, and it adds up to, we don't really know how much, but they do put overall their income, they put it out there because they're technically a nonprofit, and it's a large number. It's probably several $100 million a year. And that's if you or me or somebody else came up with some kind of code or something like that, that would not be allowed to be used. Especially Medicare and Medicaid, they have to use that code. Everybody else uses the codes too. So basically the AMA is locked in forever, unlimited free money every year.
We have the CPT codes and the ICD codes. You described the CPT codes, the procedural codes, and we're going to cover some of the same ground here as we covered with Dr. Heim. But then we have the ICD codes, the diagnostic codes. And I shared with him, and I'll share with you as well, I remember it actually wasn't that long ago that I discovered that the AMA had these copyrighted and was making royalties on them. And my instinct was like, that doesn't feel right. I think when I learned it was in the context of running a private practice, doing online telehealth, working with a biller at the time. I was still taking insurance and I was still taking patients, and understanding more about how these procedural codes work, especially as I started making that shift from therapy to coaching. And with coaching, doing cash pay, I can enter codes that are not AMA codes. You know, um, but that feels like, I think it triggers some kind of moral instinct in us to know that there's this organization almost kind of taxing all of these little transactions that are happening. And where I'll add a little extra commentary on how this affects my field, the mental health field, is a lot of patients don't know how this works when they're going to a therapist and billing their insurance for it, right? But because it's operating under the medical model, because this is treated as a healthcare expense, if you are a patient seeing a therapist and billing your insurance, then you have a diagnostic code for that as well as a procedural code. And so you have a diagnosis. And a lot of people don't know this. A lot of people have been in therapy for years and been billing their insurance, and they think they don't have a diagnosis, and they do. And then there's also a lack of education, lack of transparency, I think, sometimes in therapeutic settings about what having a diagnosis means. So someone might be diagnosed with something like anxiety or depression, and maybe it's generalized anxiety disorder, major depressive disorder. Well, these things they're not life sentences. They are actually time limited. But a lot of patients don't know that. So they treat it the same way they would treat, learning that you have diabetes, right? Well, I guess I just have diabetes for life now. So that's a sidebar that's not so relevant to what you're here talking about. I just feel like whenever we start to talk about CPT codes and ICD codes, I have to insert my little kind of therapist commentary on this issue. But that's also just the snapshot I have, the window I have in how this world of medicine works. But it's so much bigger for doctors. And so we have this government mandated monopoly because the AMA has an agreement with the United States government that they get to say what the codes are, and everyone who uses those codes, which is all kinds of practitioners for all kinds of reasons, is essentially paying royalties to the AMA. And that's why so much of their money comes from those royalties and not directly from membership dues. So before we get on to, before we leave that subject, I want to ask how that one bit of information alone leads to corruption or conflict of interest.
First of all, it's beyond the fact that it's kind of concerning that a doctor's organization makes 10% of its money from actual doctors and then the rest from this monopoly and then from consulting about that monopoly. So that's a little concerning, because then you ask, like, well, what's their motivation? What's their motivation? Is their motivation to represent doctors? And it's clearly not. It's to keep this monopoly going. So that's concerning in itself. But let's say they're just good doctors and they're just making good decisions. We should just trust them, right? Like, I know the American Association of Physicians and Surgeons has been complaining about this issue for like 20 years, but most of us just didn't care, or maybe knew it was kind of weird, like you're saying, but didn't care. Why does it matter? Well, because they use this money to lobby. So, and not only are they lobbying outside, so people in other groups are seeing that they're pushing gender affirming care, so-called, in kids, or they're pushing the diversity, equity, inclusion, which I'd love to talk about both of those issues. They're also pushing them in ways that people don't realize within all these other medical organizations. So you're always hearing like every medical organization agrees that so-called gender affirming care is life-saving care. Well, you probably know that that's not actually true, but still, many of them are falling in line because the AMA uses that money and then goes to all these other organizations and trains activists within them to homogenize, to make them all fall in line, to make them go along with the kind of the father of the mafia. And so they're using that money to twist other doctors' groups in the way they want to go, in addition to just politics in general. So when you're going to the doctor, you're paying, even if the doctor doesn't belong to the AMA, like 85% of us don't, you're still paying the AMA to twist doctors' opinions and doctors' organizations. And so then when your representative goes to pass a bill, somebody's being told by the AMA or one of their subsidiaries that they should or shouldn't vote for that bill. When your kid is getting puberty blockers and getting their literal brain and genital growth blocked at the hospital, the children's hospital, when you go to court and the other side stands up and says all medical organizations agree, and so you're the one abusing your kid because you want to protect their healthy body, that's because of all of this idea homogenization, all this evidence laundering that's happened partly from this money.
It makes me really angry to know that any of my money is going toward those things. I recently terminated my healthcare insurance because I felt like I was being scammed. So, for example, I had one of these gold tier plans and I was paying out of pocket for it, which is supposed to be good coverage. And yet, for an ultrasound, after going through my gold tier plan insurance, I'm still billed more than $1,000. Whereas I learned that if I was cash pay from the beginning, the whole procedure without insurance would have cost less than $1,000. I could have just paid that out of pocket. And that's a whole thing I could have a separate episode on, the insurance ripoff. And this part I have explained on X because it's something I feel like I understand from having worked with insurance, just basically about how the incentives are whack for insurance to charge a lot of money for things and how then patients end up getting screwed over. So I recently quit my own health insurance plan and switched to one of these health sharing alternative plans. So I'm going to be paying cash for most things and getting better deals. And then I have health sharing options for if I have a major medical expense. To me, that feels better. And I know a lot of people are just feeling about that fed up. And so I guess that's like one small way that I can take back the little bit that I'm being taxed. So the AMA, you're saying they're taking this money, these royalties from all these millions of transactions where CPT and ICD codes were used. And then they're lobbying and they're creating an illusion of consensus. You also described it as homogenized because all of these major medical associations are actually just the AMA. So, can you explain that part? What is the relationship between the American Medical Association and all these smaller groups?
First of all, it's kind of just known, everybody knows this, nobody hides this. All of these other organizations, they all send delegates to the American Medical Association. And so the American Medical Association is supposed to kind of represent their ideas. It's almost like we all our states send people to Congress or something. But those ideas definitely come both ways. And so if you're in another organization, a specialty organization, a state organization, you're going to be told, you think that your delegates are going to go to the American Medical Association to represent you, but they're going to come back and they're going to tell you, hey, this isn't what we need to do because the American Medical Association has policy on gender-affirming care already, or has policy on the language that we're supposed to say and whether you're supposed to capitalize B in black or not, or whatever. Or the delegates really go both ways. So that's pretty well known. The other thing that people don't usually know was brought out to me by somebody on Twitter, and his username is @LighthouseDPC. And he is kind of like you. I think he's off the grid. He's taking patients cash. He's saving them money, giving them better care. And if you use somebody like him, like you said, I know people that they go off insurance, they go from $20,000 or $30,000 a year to premium, and then they, to $4,000 or something, and they have a similar deductible with these health share plans, right? So those kind of people tend to use people like this Lighthouse DPC guy, who, by the way, doesn't pay me. I've never met him or ever talked to him, but I stole this from him. And so I want to give him credit. He showed how all these major organizations have people on their boards from each other. So just as you probably already know, like the World Professional Association for Transgender Health came out with so-called standards of care for how to treat kids with gender confusion. And then the Endocrine Society came out with so-called standards of care. Well, they had some of the same people running the same organization, writing the same policies. Well, that's happening at a big scale. The American Medical Association, the American Association of Medical Colleges, which is the medical schools, and all the other mega organizations that are over the small and medium organizations, they all have people at the top that are on each other's organizations. So it's really is like mafia families or ancient England or something or ancient Europe where all the kings and queens are married to each other, cousins of each other. The word would be inbred, incestuous or inbred, whichever you like, I guess inbred. And then the third way they're doing this is the AMA uses that money to do consulting. So they actually started a new shadow organization called Race Forward. And if you look online right now, you'll see that it's really the American Medical Association is one of the major organizations behind it. But actually, all the other businesses that you can think of are behind it too. So the America's so-called health insurers, which are really more like health plans that you're talking about, they're putting money into this. The American Association of Retired People, the American Hospital Association, the American Nurses Association, everybody even remotely to healthcare. If you're a nurse, if you pay health insurance, if you're retired, and all these other organizations, all their money is also going to this group Race Forward, and then they're going and consulting other groups and telling them how to make their organization more in line with these equity goals. And diversity, equity, inclusion is one of the main ways that the AMA and some of these other big organizations are pushing this transgender madness on kids and these gender harms on kids, because they say, hey, in your organization, you need to educate, even though you're just like some activist that's busy in your organization, you need to tell your organization that they're really equitable. They will support all of the gender stuff for kids. Or, for example, you may know Kaiser, like the Kaiser that did a double mastectomy and hurt Chloe Cole. That Kaiser and most Kaisers are so-called healthcare equality leaders, and they get points and gold stars from nonprofit organizations for going as far as they can and having unisex bathrooms or giving kids mastectomies with no age limit or whatever. Those things are pushed by groups that either do consulting or give awards or something like that. And that's the kind of thing that Race Forward does with the AMA's free money that you're giving them, and also with your insurers' money and your hospital's money and your nurses' money and your retired people's money and everybody's money. So this is all going on. It's right there in the open. Just nobody knows about it because it's super boring.
Are there any medical associations that aren't part of this? I think you belong to one or two.
Yeah. So my group, Colorado Principal Physicians, started almost 2 years ago to give doctors an opportunity to push for evidence-based medicine. And I don't mean like I'm an authority, so whatever I say is evidence. I mean like based in reality, and also classical liberal values. So not discriminating against people, for example, by race. And so we did start that organization. One started up in Texas as well, and some other states have talked about it. There's one major medical or association, very mainstream, very prestige, and has 96% of the possible doctors that could be involved in it are paying members. That's the American Association of Plastic Surgery. Very prestigious, very mainstream, very legacy. And they came out last year and said that they don't think that there's evidence for the safety of so-called gender-affirming care in kids. They don't think there's evidence for it working or being safe. So, in fact, their president at the time, Dr. Stephen Williams, compared it to the Tuskegee experiment, saying that sometimes doctors get stuff wrong, and instead of backing up when they were pushed, they doubled down. So there's at least that one mainstream organization, and some in Europe as well, that have kind of turned the corner on this. So there are some, and there's also some others. American College of Pediatricians, American Association for Physicians and Surgeons. Doctors can join these groups. They're not part of that unified massive mafia, the unified house of medicine, which, I worked my whole life and wanted to, get into so badly. And then they did this.
Many of you listening to this show are concerned about an adolescent or young adult you care about who's caught up in the gender insanity and therefore at risk of medical self-destruction. I developed ROGD Repair as a resource for parents just like you. It's a self-paced online course and community that will teach you the psychology concept and communication tools the families I've consulted with have found most helpful in understanding and getting through to their children, even when they're adults. Visit rogdrepair.com to learn more about the program and use promo code SOMETherapist2025 at checkout to take 50% off your first month. That's rogdrepair.com.
That last little almost side note you made, I think is actually an important point. Because when people ask me, let's say I'm being interviewed on a podcast from someone with a different specialty, and they ask me, how did your industry become so corrupt? One thing I like to point out is a lot of us worked very hard to get to where we are with the licensure. I mean, you have to get a master's degree at least, and then you have to do all of this low paying or unpaid training and take a test. And, by the time you finally get your license, you worked really hard for it. If you're like me, you still have 6 figures of student loan debt in your 40s.
Yeah, me too.
And so much is hinging on that, right? And there's kind of the illusion of authority that is vested in these credentials. And so people don't want to risk it, right? But okay, let's talk about who is driving this. I mean, I don't like to name names and slander people unless they really, really deserve it. And I think people who are pushing the butchery of children, they deserve it. So, are there certain names that are really driving this agenda in the AMA?
Yeah. So I think you have a couple groups of people, and I think the mass group of people are people that are just like, believe it or not, unaware or fairly unaware. I know that sounds crazy, but if you have a neurosurgeon working like 95 hours a week, he has no idea that this is going on. Like, I'm sorry. She doesn't, he doesn't. So you have that group of people, and maybe they're still writing a check to the AMA and they don't even know. And then you have a whole lot of people that are kind of later in their career, have some more free time, or maybe early in their career, and they're trying to get some AMA or other involvement on their resume so they can look cool or whatever. And some of those people, they're kind of peer pressured into this. Honestly, I've had one doctor like literally cry to me because he'd gone along with some of this stuff and he didn't think it was right, but he had been literally threatened by the true believers, like, you will lose your job, period. And so I think what he did was wrong to cave, but I mean, I get it. You work your whole career to get someplace, or you have like you and me, 6 figures of debt in our 40s. People kind of have you hostage to your license and your certification. So you have the people that don't know, you have the people that are just going along, and then you have the true believers. And I think those are the people that are pushing it. I won't name a lot of names, but just as an example, with the American Academy of Pediatrics, as I'm sure you've probably covered in previous podcasts, Jason Rafferty wrote the guidelines, so-called, for pediatric gender-affirming care, so-called, from the kid doctors, the pediatricians, in 2018. And he did that by himself. It's his name on these recommendations, these guidelines. And he was like a year out of his postgraduate training. And he was one of 4 people that had that were even on this committee, this LGBT committee. So what happened is, my point is, you have these activists that are super driven. So you have American Academy of Pediatrics, the kid doctor organization. They have 60,000 members. Well, out of 60,000 members, they had 4 doctors on the activist LGBT committee, which is totally a committee that you just get on and you're like, I just want to get my, crazy transgender ideas through and hurting kids, basically. I know they wouldn't phrase it like that, but that's kind of how it's working out. So you got 4 people that are activists. They get 1 person to write it, and then everybody else falls in line, either because they're threatened or they're afraid or they're just going along. And the kids are still being harmed from that years later. In 2023, they reissued the same exact guidelines without any changes at all, and they still haven't done a review of the evidence. Just this one guy, this one newbie, is writing this. So Jason Rafferty, and now I'm afraid him and the American Academy of Peds are getting sued by at least 1 patient. So the answer is, I'm not going to name a lot of names, but it's a minority of people that are very influential, because they figured out that when you pose this as like a rights issue, you're discriminating against these poor transgender people, and if you don't give them this medicine that blocks their brain and body, that goes a long way in America. We all have a lot of sympathy for that.
Yeah, well, it's psychological manipulation. Who is Jason Rafferty? What is his deal? What's motivating this guy?
I'm afraid I don't know him personally, so I can't say. I've had a little interaction with some of these people, and I think a lot of adults. You have adults like last year is Admiral Levine in HHS. You have Dr. Marcy Bowers. Dr. Bowers, who literally cut off Jazz Jennings' parts when he was 17 on cable TV. You have these people that grew up and they really think that their gender affirming so-called medicines and surgeries really help them. And so they wish that they could have had it when they were kids. But, they've grown up and they've had a life and they've got to make that decision later, and both of them have kids. So they're really taking away something from kids based on their ideas, their ideals. So, you're really sacrificing these kids based on your faith in a non-provable, non-disprovable gender religion.
So Levine and Bowers are both autogynephilic male transsexuals. For anyone who's missing that part, Jason Rafferty is not a trans person, right?
Not to my knowledge.
Okay. Okay.
And you have people like Jack Turbin, who's again fresh out of residency psychiatry UCSF, and I don't know if I think some of these like him, for example, he's gay. I have friends that are gay and they're super against this. I have a lot of friends, I would say, that are gay or lesbian and super against this. Thank God for the Gays Against Groomers and some of them right now. But I think that you have a lot of people that were moving along with this rights movement for gay marriage up to 2015. And when gay marriage got okayed, you had a lot of normal gay guys, normal lesbians go home, get married. And you left the really kind of off people in the building still trying to make the $80 million a year or however much that Human Rights Campaign makes, and some of these other nonprofit organizations. They got to make the money, they got to have the scare, they got to drum up the hate, and they got to have the the human rights movement that is very powerful speech in our country. And unfortunately, they picked this thing about healthy people, turning them into something that doesn't work. And the bad thing is, for this rights movement to work, they have to have the fake science. And so they've turned their kind of guns away onto the medicine, and we're getting these medical organizations now becoming activist organizations, putting out totally pseudoscientific statements about gender affirming so-called care. And so that it's Candace Jackson calls it fake rights, fake religion, fake science. And it's that obsession with the fake rights, fake human rights, which I'm sure some of these people, Jack Turbin and some people probably believe, it's turned that obsession with fake rights into they have to make the fake science. They have to drum the fake science out of us. They're going to squeeze it out of us one way or the other, because if they don't have the fake science, they can't have their little fake rights campaign.
So you said that 85% of doctors are not AMA members. And then you talked about, you expressed your belief that most doctors don't agree with this fake science. So it's my understanding that most doctors work within the healthcare system. So we talked about these alternatives, for example, the cash pay alternatives, like your friend and like what I will be doing. And I know some doctors go both ways. Like I have a doctor who has accepted my insurance, but I will be paying her directly now. Given that most doctors work within the constraints of our healthcare system as it is in America, um, I get the sense that it's a really tough time to be a doctor, because there are so many, especially if you are someone with a real heart for this work, someone who's called to be a healer, that you have to operate within all these constraints, the pressure to see 50 patients a day, and the pressure to prescribe the pills that are most commonly associated with that code in your computer. And then there's the pressure to go along with this stuff. So what's your estimate? And I know I hate it when people ask me these like big picture estimate questions, because I'm like, I don't know. but what's your sort of best guess as to how most doctors are relating to the pressures on them these days?
Like pressures in general?
Well, sorry, I'm kind of asking you like multiple questions rolled into one. I guess what I'm doing is making the connection between the pressure on doctors to go along with the fake science that recommends harmful practices that shorten lives, I'm connecting that with all the other ways that doctors feel like they're constantly kind of pushing against walls kind of closing in on them with all the pressure of how the healthcare system is just so deeply flawed. But on this one issue of pediatric sex trait modification, let's say, or more broadly, sex trait modification, because nothing magical happens when you turn 18. It's not like suddenly a good idea if, if you're 19. Um, what's your sense about, how many doctors are reluctantly going along with this? How many are secretly working in opposition to it? How many are in the dark? You said that there might be, for instance, a neurosurgeon working 90 hours a week who just has no idea what's going on because they're so narrowly focused on their niche.
Yeah. Yeah. It's a great big picture question. Let me give what data I have. And I can give anecdotal data all day long if you want. It's fun to talk, but
anecdotes are
okay.
cool.
Okay, great. Thanks. So for example, in the Texas Medical Association, this is published in, I think it was the Dallas Morning Star, and then Manhattan Institute did a really deep dive a month or two ago, which is a must read. So in the Texas Medical Association, which kind of represents most Texas doctors, I'm sure more than half, I'm not sure exactly, but they had a vote, and the vote was whether they should base their pediatric sex trait modification, they called it gender affirming care, statements on evidence. Okay, very mild. It's just saying like, hey, we should look at the evidence. Okay, not like a set your hair on fire kind of statement. And 85% of the doctors voted in conservative Texas not to do that. In other words, just fall in line with, Solidarity, AMA, everybody.
Oh.
That's pretty embarrassing, and it should really waken you up to how bad these red states are too.
Sorry, why vote against it?
And the reason is because, number one, the vote was just of the leaders. They have delegates and stuff just like the AMA does. It was just of the leaders, the people that are really kind of bought into the system. And so they don't want to break ties with the AMA. They want to break ties with my guess is the Pediatric Association in Texas. I would bet money. I don't know this, but I bet money was involved in making sure that vote went that way. And so you have these leaders that are really captured. They're part of the machine. And so they voted against that because they didn't want to look at the evidence and find out that, hey, all these other organizations are wrong. Now, I hope that's a real black pill or challenge for a lot of people in red states thinking like, hey, I'm in this red state, everything's fine. Now, on the other hand, a little white pill is in Colorado last year when we had a vote, not that we should look at the evidence, but that doing this to kids, even just the medicine, was literal female genital mutilation, which is a federal crime.
Yes.
Guess how many doctors, guess how many doctors in Colorado, blue Colorado, voted for that? To say,
no idea.
Okay. When I ask crowds, sometimes I get people like 0, 10%, and it was 62% of doctors in Colorado. But the difference is in Colorado, I mean, that's pretty great, right? That's 2/3 saying that this is horrible. You should never do it to kids, not even just the medicines, not even the surgeries. So my feeling is that the doctors that are really involved in the organization, even in red states, tend to be for this. But your average doctor who has common sense and is like, oh yeah, I don't want to stop puberty on a 12-year-old because they need those hormones to grow their brain, right? Like every doctor knows that, just like every grandma throughout history has kind of had that feeling. So I think most doctors are probably still on our side of wanting to go with like reality and protect kids. But I think at the higher levels, they get more and more into this kind of system. And a lot of the higher up doctors are also involved in academics because it's, more prestigious to be at a university or something like that. I'm fortunately in private practice. So that's probably, if you look at it socially, one of the reasons I'm speaking up, because I can. But if you're at an academic institution where 95% of the students are going to call you bigoted and discriminatory, as I have been called, it's just going to be harder to speak up. So these big institutions, the professional organizations and the universities are really kind of helping tamp this down.
So a moment ago, you talked about this vote with regard to cross-sex hormones just the drugs, not the surgeries, being considered a form of female genital mutilation. For people who didn't put two and two together before this moment, can you explain how that works?
Yeah, thanks for asking. Sorry, that was kind of obscure. So my original job or my original training after medical school was 2 years of OBGYN. So I delivered a couple hundred babies, helped with the pelvic surgeries. And in those days, the 2010s, the old days, the before times, medicine was and had been very up in arms for decades, and rightly so, against what's called female genital mutilation. So in a lot of countries in Asia and Africa, it's distressing. Sudan, Yemen, these countries, they'll do pretty horrible things, mostly surgical, to girls' external genitalia, girls' vulva, girls' clitoris. This isn't primetime TV, right? So I can say these words.
No, you can say.
We're clinicians. So they will permanently disfigure their external genitalia so that basically for the rest of their life, they won't be able to have sexual pleasure, or it'll be painful to have intercourse, not to mention to have a pregnancy delivery. So pretty horrible things. And I want to make clear that this is obviously bad. It's obviously harmful. It obviously takes away future choices from these girls before they're even adults. And nobody needs any research to do this, to figure this out. And medicine knew that. And in the 90s, 2000s, 2010s, if you were in medicine, especially in OBGYN, you'd hear about this and how bad it is, which is good. It's bad. Yet then with pediatric gender affirming care, forget the surgeries. People always think I'm just like up in arms about the surgeries. Yes, the surgeries are horrible, but the medicines, puberty blockers, stop development of the same organs that are harmed in female genital mutilation, stop development of that in girls and in boys. Dr. Bowers, the WPATH, or World Professional Association of Transgender Health president, Dr. Bowers said that Dr. Bowers didn't know any kid that had been put on puberty blockers at the age that Medicaid and stuff pays for, and up through adulthood, didn't know any boy that did that was able to have orgasm, able to have sex as an adult. So you're doing like kind of the same thing in boys and sort of literally the same thing in girls. Estrogen or cross-sex hormones, giving testosterone to women. So I hate to tell you this, but I did give testosterone to a few adults when I was early in training. And we can talk about that if you want. But I've seen the side effects, which is in like 100% of people, of women that take testosterone. Just as you know, there's side effects in tons of women that go through menopause. And these side effects are distressing, can be very distressing, very painful, very itchy, even bleeding and stuff like that. And these are just uncomfortable topics to talk about for most people because you're talking about the genitals. And these damage, again, some of the same organs that are damaged in female genital mutilation, which can cause pain, bleeding, pain with sex, pain and discomfort just sitting around. And so even just the medicines are disfiguring and altering some of the same tissues that are altered in other countries. And so when I presented that policy, I was just pointing out the obvious hypocrisy that we don't need a study to know that hurting kids is bad or that taking away their future choices is bad. We don't need that. And literally, if you read the federal code, I mean, some of the medicines do some of the same exact things in female genital mutilation. And so we should condemn doing this to kids already with the laws we already have on the books, full stop.
Yeah, this is an important point for anyone who hasn't completely researched and thought through this issue. So I'd like you to clarify what specifically puberty blockers do to girls, because I know less about that. And let me just break down for people about, the harms of testosterone. And yes, if you'd be willing to share what you saw in your patients. But I would say there's kind of four major categories of how testosterone can create genital mutilation, will create genital mutilation in women. So one would be clitoral enlargement, which can lead to painful chafing. The second would be vaginal atrophy, which, as you pointed out, can lead to bleeding, can lead to The vagina being unable to tolerate any kind of insertion of, whether it's sexual, tampons, anything like that. The third would be the atrophy of the reproductive organs that can lead to medical necessity of hysterectomy down the line. And the fourth being urinary tract issues. So these are 4 different ways, at least that I know of, as someone who's just been studying this issue for a few years, that testosterone creates pain in women. And it's my understanding that 95% of females who take testosterone end up with some type of pelvic floor dysfunction. So I'd love for you to add to that.
Yeah. So, you said it perfectly. I'll memorize that and repeat it in the future and give you credit. Okay. But you're referencing at least one study that we've both seen, I can tell. So, but that was also my experience is when I would see, so some of this is hard to talk about because when you say, well, somebody has vaginal atrophy, well, that sounds so clinical. What does that mean? Well, their vaginal tissue can be very dry. Okay, so what? Well, it's itchy. So what? Well, for guys, it's really easy to just be like, who cares, I guess, apparently, because that's where we're at. But when I took care of mostly only women for my first couple of years of being a doctor, that is extremely, extremely bothersome when your vagina is extremely dry and itchy all the time. Not to mention, even if you want to have intercourse or you need to have a medical procedure, that can take over your whole mind like all day. It can be very severe. And if you have a couple of friends in menopause or grandmas or mothers in menopause, some of them are going to have that kind of story to tell you. And they're not even purposely taking testosterone. They're just losing the estrogen. I don't think I've talked about this publicly before, but like I would at times have to do pelvic exams on what people now call transgender men, which is a woman taking testosterone. And if you had a medical reason to do that, it's very uncomfortable because the vagina can actually, in common terms, you'd say shrink or something. I don't want to use any foul terms or anything. I'm trying to use my words carefully, but basically shrink and become smaller. So it's harder to admit a clinical speculum or something. And it would bleed, it would tear easily. And even though whether or not that person was trying to have intercourse or wanting to have intercourse at that time, it could still be very uncomfortable and bleed. And then you have people like Prisha, who, I can't verify this myself, but she reported that part of the reason that she had to have a C-section was because her doctor was concerned that her vagina had atrophied so much, and her tissue had atrophied so much from the medicines. So these are really easy to not care about. Again, I guess, unfortunately, if you're a guy or maybe if you're a young, healthy woman. But you have pelvic floor dysfunction, like you said, over 90% of women get when they're on testosterone. And the study that I think you're referencing, that was talking about young women, like in their early 20s, I believe. Well, pelvic floor dysfunction means like you're leaking fluids out the front and possibly the back.
Right. I forgot to mention incontinence. Yeah,
because the pelvic floor is the muscles that support those things and help pinch off things so they don't leak. And, like maybe on TV you see jokes about pregnant women or postpartum women, they, leaking urine a little bit, or people in menopause leaking urine a little bit. It's not super funny. It's funny to joke about and that's fine if people want to, whatever. But if it's you and you smell like urine or you smell like feces or you have some on your undergarments or something, like that's not cool. And it's not cool if you're, 55 or 65 and you've maybe delivered a couple babies, which is wonderful. And, you're not on hormone replacement therapy for some reason. And that's occurring to you when you're older. I'm really sorry. And that's really bad, but we can all agree it's super bad if doctors are doing that to 20-year-olds. It's horrible. They're having grandma pelvises when they're 20. It's just astonishing. And the thing is, the reason I started speaking about this is because it's so obvious. Like if you've seen it clinically or if you've studied it clinically, it's just so obvious what the outcomes are going to be. I knew they'd have pelvic floor dysfunction and vaginal bleeding and pruritus is the clinical term, itching. Those are all predictable things. I knew they'd have overgrowth of their clitoris. I knew that boys wouldn't be able to have sex, which Dr. Bowers has openly admitted. These things are all predictable. And I knew that their brain wouldn't develop because the brain depends on endogenous or self-made sex hormones to develop during that time frame. So these are all predictable things. And guess what? There's studies that point to that, and there's case series that show that's the case. So it's just so obvious. It's just like Twilight Zone. Sometimes I can't believe I'm sitting here talking to you about this.
Yeah, the things we're discussing, they're painful and humiliating, and they're easy to write off only if you have hubris, which unfortunately the people most affected by this issue do, right? They're young, they think they're going to live forever. They think old age and disease are things that happen to people other than them. They think that this is definitely not a choice that they would ever regret, and that's why we have things like my whole program for parents, ROGD Repair, which is designed to help parents understand the psychology of adolescent and young adult development and the communication approaches that are going to work and going to backfire when you have a trans-identified youth. And so it makes it so hard for parents to talk to their kids because the kids are rather glib in many cases about these things that are actually quite serious and, like you say, unfunny to deal with. Things like urinary and fecal incontinence are actually humiliating and really socially isolating. And you raise a good point that it's one thing to encounter those problems later in life after you've had a good life. It's another to never be able to even come into your body's fullest expression in young adulthood, when I believe all of us should ideally have a shot at knowing what it feels like to be in a really healthy version of our own body before it starts declining, because it will. By your 30s your body will start declining. So I believe it should be considered everyone's birthright to experience their body in its peak condition. It just makes me so sad that these young people are going straight from an unhealthy lifestyle in their adolescence into destroying their bodies in young adulthood and never knowing what it feels like to be healthy. The other thing I really want to make sure to say here is that when we talk about the effects of testosterone on women, we're not talking about side effects. We're talking about effects. This is what testosterone does. And that's another thing where I hear what parents report their daughters saying. Again, it's very glib, very dismissive. Don't show your daughter this podcast. Instead, if you have a daughter or a son who's in this, take my course, learn how to communicate with them, because this podcast is not for them. I will teach you how to communicate in the course. But just to sympathize with what the parents are dealing with here, these things are often dismissed as side effects rather than main effects, and as things that might happen in a small percentage of people rather than things that will happen to me. And then furthermore, there's this sort of assumption that they're a lot more treatable than they are. And this is one thing I'd love to get your commentary on, by the way, Travis, because one thing I've heard many times now is the daughters will say, well, if I experience that rare and mild symptom of, vaginal atrophy, for example, then the doctor says that's treatable. I'll just apply a topical estrogen cream. So, Travis, if you had a patient with that misunderstanding of how treatable vaginal atrophy is, what would you say?
Yeah, I don't treat that anymore, so I don't want to give like too specific clinical advice. But I will say I do see side effects from hormones for this purpose, and like you're putting it, these aren't side effects, they're expected effects. If 95% of people are getting this, it's not a side effect. If I could have told you before you did it, it was going to happen, and then you did it and then it happened, it's not a side effect, it's an expected effect. So, I mean, I wish I would be able to ask that person questions like, are you surprised this is happening? Would you, expect this to happen biochemically? So you think that the best plan is, do you think the best plan is to basically keep doing the thing that causes the problem and then like try to put a bandage over it? Like, those are the kind of questions I try to probably ask to get some ambivalence there or some insight, because I think how you're putting it is correct. They're expected effects. And just real quick, I want to say I'm thankful that you're offering patients, families something, because right now it's really hard to find help and support for these families. And in states like mine, it's illegal for therapists to affirm a kid's actual biological sex. And so it's really hard to get help. So I'm very thankful that you're out there.
Are you a therapist in need of continuing education that's not over-the-top woke? Check out my colleague Lisa Mustard's pod courses. All of her pod courses are approved by the National Board for Certified Counselors. Right now, Lisa is offering my listeners an incredible deal. Get all 27 pod courses for only $44. That could meet almost all of your continuing education needs for the year. Visit lisamustard.com/podcourses and use code SOMETherapist to take $5 off of her $49 pod course bundle. Again, use code SOMETherapist at lisamustard.com/podcourses. I'll include that link and coupon in the show notes for your convenience. All right, now back to the show.
Well, speaking of Colorado, we recently had a Supreme Court case, Childs versus Salazar. I discussed that on episode 183 with Elspeth Cipher, and I would also encourage people to read the link that I put in the show notes of that episode, which will take you to Glenna Goldis's blog where she talked about that case. So this issue is, currently at the U.S. Supreme Court because of these misleadingly named. Actually, I'm not even going to say it because I don't want the YouTube banner. If you're a long-term listener, you know what I'm talking about. I'm not going to say the keyword that'll tip off that particular banner. I think we've got on a little bit of a sidetrack because I really wanted to invite you as a doctor to explain about testosterone and female genital mutilation for people who may not have realized how that all connects. I'm trying to remember where we were when you first brought that up.
The definition of female genital mutilation, you can look it up. There's federal code that bans it. It's like 10 years in jail. And anything that damages or cuts the external genitalia structures, clitoris, vulva, the introitus to the vagina, the beginning of the vagina, those things are all considered female genital mutilation. And it's very clear that even just constricting these things, which is what these hormones do. So giving somebody testosterone is going to if they're young enough and you put them on puberty blockers, somebody's vagina is not going to develop fully because it's stopping the normal healthy estrogen that's supposed to help things grow. Estrogen helps them helps women get a healthy endothelial cell lining or mucosal lining, basically a healthy lining in there. And when you stop that with puberty blockers, you're cutting out the estrogen that the whole body, brain, and vagina need to grow. And then if you put testosterone, the testosterone is going to stop that as well. Kids don't have to be on puberty blockers their whole life. Once they switch to testosterone, people either stop or wean off the puberty blockers, and they're just on testosterone. And that also blocks basically a woman's internal estrogen. And so it's going to be not only not help letting that develop, which is constricting the development of a healthy vagina, the testosterone is also going to further dry out and cause stenosis or uncomfortable, painful tightening of that organ, which is technically, if that's happening at the introitus of the vagina, if that's happening to the vulva, if you're getting overgrowth of the clitoris, like you said, those things are all technically female genital mutilation, and there's no knives needed. That's the medicines doing that.
So a lot of people who are angry, understandably so, about these issues, they want to see doctors punished. They want to see people thrown in jail. And you just said that in the United States, someone performing female genital mutilation could get 10 years in prison. Do you know if that is an angle that is currently being tried in our justice system?
I have never heard of a case of that in this setting.
Seems like there should be.
I mean, yeah. 100%.
Gosh, how do we tie this back to the AMA thing?
Well, it is all related. So when you buy a newspaper in New York or Los Angeles or London, you think you're getting the local news. But as you know, sometimes if you go to a website or a newspaper, sometimes they just copy the same article from the Associated Press or one of these other news systems. And so you could literally buy the same, you could be getting the same story thousands of miles away and think you're getting an independent story, but you're not. Well, the same thing is happening with doctors right now. There's 1 million doctors in the country, and you think they're all saying one thing because the AMA is not only saying that, they're making all the other organizations say that with your money. And they're the ones that are leading in keeping anybody from stepping out. So when all the medical organizations are against you, you're not going to win a court case if you're on the other side. So you're going to lose your kid. And I have friends that have lost, I wouldn't say friends. I mean, I have people that are now my friends. I know adults in this state that's happened to and across the country, because so-called every medical association has lined up under the American Medical Association and the American Academy of Pediatrics pushing this. So doctors, all the leading doctors that end up on the medical boards that can take away your license or mine or put me on probation right now for talking about this. The people that can literally take away my certification and therefore my ability to bill, my ability to work at a hospital. Right now, they could say I'm being unprofessional because I'm speaking against diversity, equity, and inclusion, which I am. And they could take that certification away, and then I'd be out of a job and be out of a house in a few months too. So that is that complete alignment, that mob-like alignment is starting at the top at the American Medical Association, and they're doing it with your money.
Well, we covered the DEI issue many times on this podcast, but for people who are new here and who are like, what kind of demon, as opposed to such good things as diversity, equity, and inclusion, sounds so positive, right? What's your elevator pitch there for why a doctor should oppose DEI?
Yeah, I mean, the words sound great, but I think James Lindsay defines it best with diversity, saying something like diverse in appearance, but all the same in thought. And basically, the diversity and inclusion that they're wanting is basically all one kind. So when you listen to it, you're like, oh, cool. It's, we want to have all kinds of different people and even different races and stuff. Great. But they'll fire you if you're black, if you're a black woman, if you disagree on the DEI stuff. It happened to Dr. Tabia Lee. And so it's not the good stuff it's cracked up to be. It's actually a way to put through some of these other ideas, like the pediatric sex trait modification, which any disagreement on this issue is definitely not considered to be equitable or inclusive. Believe me.
So how do we get out of this? What can doctors or patients do?
Yeah, that's a great question. So, lawsuits, when they're, legitimate, that probably moves the needle. I think it's great that most states have worked to ban pediatric sex trait modification. I think one state, Florida, has done some work to protect doctors. So if a doctor speaks out, they could, and their board or their certifying board tries to kill their career. Florida is the only state that I know of that will really aggressively protect that doctor. Basically, your other 49 states, to my knowledge, it's just like, sorry, thanks for speaking up. And so I think a lot of this problem is because the diversity, equity, inclusion, or DEI, has really killed the free speech of doctors. And so the natural kind of way we try to clear this problem out is just really difficult. So it'd be great if you're not a doctor, if you want to encourage if you want to encourage better laws in your state for doctors to speak up, that'd be great. I know that's not really actionable for most people. I do think most people can help out by supporting people that are doing stuff. And I'm not asking for any support, just to be clear, but they could support you. You're helping actual parents that this is happening to. Also, I think people in media, like you are at this moment, are really important, because I think changing the conversation is really the most important thing that we need. We need more and more people to know what a problem it is. There's groups like Do No Harm Medicine that I'm a member of. There's other groups that are doing things to actively change this. So I would say, however you can, if there's anybody near you that you can support, please do. And if there's anybody near you that's kind of in the middle, send them this podcast or send them another one of your podcasts, send them an article, and have a conversation with people, because really we need to change the culture and alert those neurosurgeons that are working 95 hours a week and our friends that are working and busy. We need to let them know what's going on and see if they're interested in helping, because we really have to change the culture.
And how did you decide how to handle this in your career? Because there was a time that you were underground with your concerns. You even said early in your career you were doing things that you now regret. So, how did you make the decision to do what you're doing, and has that created any problems for you yet?
Yeah. So, I moved into a different field of medicine, so it wasn't super relevant to me on a day-to-day basis. I wasn't aware of what was going on. And then I got out and I was working my first couple of years, and again, multiple six digits in debt, just trying to stay ahead of the mortgage and everything. And then it was around 2021 when I realized, like, holy cow, they're actually doing this to kids. Like, again, to adults, people have debates. I don't disagree with anything you've said, but people have debates. But to kids, it's just like, it's so clear cut. You can't paper over it with all the fake evidence in the world. It's just so clear cut to me, especially because I'd seen it in women in their 20s or 30s or so. I'd seen it. It was just so clear cut to me. It wasn't, it was clear not only that it was bad, but it was clear to me that there's no evidence for it. And I looked into it. I spent hundreds of hours looking into it to see if I was right or wrong. And there's clearly not evidence for it. In fact, there's evidence for harm. And so I knew that this wasn't an issue of like, oh, this is where the evidence is, and in a couple of years the evidence might change. This was an issue of activism. Activism had taken over my profession. And so I realized that the only way to stop this, it's from the outside. Like, I hate to say this, but doctors are not going to come and save the day. It's not happening on this one. I'm sorry. And it's very embarrassing for me to say that as somebody who's, was so proud to get into medical school and so forth. Doctors are not going to save the day. So when I saw that it was not based on evidence, it was based on activism, as my friend Eddie Waldrop says, I knew I had to speak up because, I in my state, I was like, I'll just find who else is speaking up, and I'll, follow them or, help them or see if they need help. I couldn't find anybody, and you're like, wow, really? 17,000 doctors, nobody's addressing this. So it's completely a duty issue for me. We took oaths to first do no harm, and we're violating that oath. And, you take oaths because someday there's going to be a time where you don't want to keep the oath, or otherwise you wouldn't need it in the first place. And this is one of those times where doctors really have to put that oath first and that duty first. And I'm very happy to see many doctors are doing this, in the background or in their professional organization. Not all of them are, media savvy or out there, whatever, but I'm happy that there are a lot of doctors doing it. And I wish there was, 1,000 times more.
That's such a good point. You take an oath because there's likely to be a time that you're going to be tempted to break that oath. That's the purpose, right? And it reminds me of um, just one of my Christian teachings that I was reflecting on this morning, that it's easy to love those who love you. It's easy to hate those who hate you, but loving those who hate you, that's where the real work comes in. And similarly, right, that's why we take an oath. It seems like the same principle at work there. So you said you're in private practice, so what exactly are you doing now?
Yeah, I'm a melanoma expert. So most of what I do is skin cancer. I take care of patients. I take care of serious autoimmune diseases. I take care of skin cancer. I run a lab that I'm a director of, and I diagnose things under the microscope. So I went a totally different way after 4 years of OBGYN and then family medicine and preventive medicine. And then I went a totally different way. So this is, I'm only doing this as part of, as just a belief in medicine and belief in evidence and belief in protecting kids. And so I'm thankful that I'm able to work with doctors of all types of specialties in my state group. And I'm thankful that I'm, not in like pediatrics right now, because to be honest, it's probably really hard to speak up for the pediatricians.
Yeah. Yeah, I bet. You had mentioned that I had given you some encouragement before you were public, and I'm curious about what tipped the scales for you. And now that you're here as a licensed doctor who is openly standing up against the woke DEI stuff, as well as the push for pediatric sex trait modification, I'm curious what you would say to other doctors or anyone else, kind of curious about following in our footsteps, maybe afraid of the repercussions?
Yeah, great question. That's kind of what I asked you a few years ago. So yeah, as soon as I found out, as soon as I realized this was going on, and then I was, hearing more about the DI stuff, which concerned me from just like a racial discrimination standpoint, and I feel like that undercuts the whole idea that people can have compassion across races. I really hate that, the anti-compassionate part about it. When I heard about these two things, I knew I had to do something, and so I did start speaking up immediately, just within like my what I could. So my professional organization, my colleagues, and so forth. And it got to be a point where I felt that at least my state needed somebody to speak up more publicly. And like most doctors, I don't have a podcast. I didn't have any social media. I'm pretty busy on X right now, or Twitter. Only because of this. I really don't like social media. I mean, I enjoy it now, unfortunately. And so I talked to you, and you were pretty honest. You were basically like, yeah, there's pros and cons, but it's worth it, is the quick summary. You weren't like, oh yeah, it'll be fine. And yeah, that's what I found. I think any doctor, wherever they're at, should 100% speak up. You may not be on a podcast tomorrow. You may not even get social media. You may not be in the newspaper tomorrow, but you really should speak up to your colleagues, to other adults, wherever you're at, just in the whatever realm that God has you in, or wherever you find yourself. You definitely have a duty to speak up. And if that grows, then you should go with that. And are there some negatives? Yeah, I don't like to underscore those. Yeah, but to be honest, but to be honest, I think for most people that I've talked to, most of the worst stuff doesn't happen, or at least doesn't happen for a while. And if we could end this and restore trust in our professions, which is going to take a long time, and hopefully help heal some of the people that have been harmed by our profession, and the families that have been irreparably harmed by our profession, I guess it doesn't matter. I think, to be honest, I just think it doesn't matter. Unfortunately, it's your duty to speak up, and it doesn't mean you have to go on Twitter and set your hair on fire. But you do need to speak up. You do. Yeah.
In fact, Twitter's probably the wrong place for most people.
Yeah.
There's a sense that you're doing something by going on social media, but there could be something much more impactful that you could be doing that could also be a lot less stressful. Speaking up does not mean speaking up on social media.
No, I think actually stay off of social media if you can. Again, you should speak up wherever you have legitimate authority and legitimate jurisdiction. So if you're involved in your medical society, or your specialty society, or your practice, your hospital, you should speak up wherever you are.
Well, I think that's a great note to end on, Travis. Was there any thread that we left open that you wanted to close?
The only thing I'd say last is that, people like you and I are often called different things. And I think people should understand that the whole entire reason that I'm bothering, and I'm sure that you're bothering to do this, is because we have a great compassion, first of all, for the kids and youth that are experiencing this distress, a very close second for their families that are often torn apart, maybe for a long time over this. And if anything, I just want those kids and those families to have more choices, more love for each other, more opportunities. And I would encourage everybody to think about what we can do for those kids and for those families going forward. Many of these kids in 5, 10, 20 years are going to be struggling with how to make sense out of life coming back from this. And I hope that we will be as compassionate and open to them as we can.
Absolutely. Way to bring it home. Well, thank you so much for the wonderful work that you're doing, Dr. Travis Morrell. Where can people find you?
Yeah, well, you can find me on X at Morrell, 2 R's, 2 L's, Morrell, MD, MPH. Morrell, MD, MPH. And they can, if they're a doctor, please check out my website, or if they're healthcare and they'd like to contact me at coloradodoctors.org.
Wonderful. Thank you so much. It's been a pleasure.
Thank you. The pleasure's all mine. Thank you, Stephanie.
Thank you for listening to You must be some kind of therapist. If you enjoyed this episode, kindly take a moment to rate, review, share, or comment on it using your platform of choice. And of course, please remember, podcasts are not therapy, and I'm not your therapist. Special thanks to Joey Pecoraro for this awesome theme song, Half Awake, and to Pods by Nick for production. For help navigating the impact of the gender craze on your family, be sure to check out my program for parents, ROGD Repair. Any resource you heard mentioned on this show, plus how to get in touch with me, can all be found in the notes and links below. Rain or shine, I hope you will step outside to breathe the air today. In the words of Max Ehrmann, with all its sham, drudgery, and broken dreams, it is still a beautiful world.